Naval Medical Center Portsmouth's Emergency Medicine Residency program graduated the 2013 class of residents June 26th. The 8 members have now completed their undergraduate degree, medical school, internship, and 3 years as a resident to become a specialist in medical emergencies. During the ceremony, one speaker reminded them that their journey of learning is not done.
The practice of emergency medicine is extremely rewarding, but at times very humbling. There's no top of the ladder. Once you think you've reached it, there's always another rung to climb. Your training is never over. It's just at a different phase now. Your decisions need to be quick and correct. That's an enormous level of trust, but it's a trust that you've earned due to your residency, and it's a trust that's a privilege, and don't take it for granted.
They received accolades and parting words of advice from the keynote speaker.
I've watched you guys do some amazing things. I've watched you choose right over popularity on the floor. I've seen you choose work over ease. I've watched you choose honesty over acclaim. And I've seen you succeed.
Some of those amazing things and successes include 8,100 emergency procedures, 3,300 critical care resuscitations, and seeing 71,000 patients. The variety of patients, their acuity, and the procedures are the reasons why doctors like Lieutenant Commander Sean Conley chose this specialty.
We see whatever comes through the door, any and all comers, from newborns to the elderly, people who have simple orthopedic injuries, to those with heart attacks or strokes. We work with the nurses, the corpsmen. It's a full team approach.
Seeing a steady stream of patients day and night at the busiest ER in the Navy helped prepare them as specialists, and so did the deployment and teaching experience of their program director.
I've been deployed a couple times to many of the different echelons of care that, as it turns out, most of the EM graduates go and serve in, because most of them go and serve with the Marines. I think I do have a little bit of insight into some of the other inter-service things, since I have experience training Air Force as well as Army people and now Navy people as well.
Knowing how to prepare for and what to expect in a joint theater is critical.
It's nice to know that we all speak the same language, that the training is all comparable, and it certainly gives us reassurance that we can deploy in a joint theater and be able to interact fairly easily with the other services.
These 8 emergency medicine physicians are now prepared to practice extreme medicine, often in extreme conditions. Reporting from the Emergency Medicine Residency Program graduation, I'm Rebecca Perron.